Good evening. My name is Dr. Nicole Ulrich, and I'm a neurologist and neuro-oncologist and what I call an NFologist at Boston Children's Hospital and Dana-Farber Cancer Institute. And today I'm going to have our fireside Zoom chat with one of my favorite patients, Brianna Worden, and I'll let her introduce herself.
Hi, everybody. I'm Brianna Worden, and I'm the 2020 National Ambassador for the Children's Tumor Foundation. I'm really excited to be able to join you all through Zoom. I've been an advocate for CTF since I was about 7 or 8 years old, and I've known Dr. Ulrich for as long as I can remember. So I'm really excited that she's able to join us as well.
Yeah, I actually looked back, Brianna, and I think I met you when you were 10.
Oh,
And
wow.
so more than half of your life, I've known you, but I think I've known you from afar for longer than that.
Yeah,
So, over the time, we have developed a relationship and kind of participated together in this journey that we call NF. First, from a time when we had no treatments available really for NF, and then through now our second clinical trial together for targeted therapies for plexiform neurofibromas. And, I think we've gotten to know each other pretty well over that time, but I think sometimes it's good for people to hear what it's like to participate in a clinical trial, and it's what it's like to go through that experience where now we have moved into an era where we actually have some treatments available. So maybe
definitely.
you can
And
talk a little bit about your experience.
so I was a little nervous to go on a trial, as I feel any patient was. And I was at a time in my life where I felt like my quality of life was going downhill. My arm, or my elbow specifically, just kept what I kept feeling like a subluxed feeling. So I kept feeling like my elbow was dislocating. And my tumors were just growing so rapidly that my skin kind of felt like paper. So if you would just go like this, my skin would crack open. I couldn't wear long sleeve shirts. And it was around wintertime because it's getting cold, if I recall. It was around October. And I just remember sitting with my mom, Dr. Ulrich, and other physicians, and just telling them I was at the point where I wanted my arm to be amputated because I couldn't take the stress of the dislocation feeling, and just again, my overall quality of life was declining. And luckily, I was a candidate for this MEK inhibitor. And though the side effects can be hard at times, as will any medicine, my tumors are shrinking, and shirts that didn't fit me before are now fitting. I am able to lift my arm up higher than I was able before. I had to do these peg tests for the clinical trial, and just being able to pick up a peg was so exciting to me because I was dropping things. I couldn't pick up even a gallon of milk without it just I remember one time I cried. I picked it up and it spilt all over the floor just because, again, I couldn't pick it up, and now that I can, it's just amazing to me. So I know with neurofibromatosis, it's always an unknown and always it's so hard to deal with. But luckily, because of the Children's Tumor Foundation, my doctors, this clinical trial is working, and I really think that we have to keep advocating for this. It's extremely important.
And Brianna, one of the important things that you brought up is kind of how you have experienced some gain of function in your arm, and that's something that, as people who plan the clinical trials, that's been an important thing for us to evaluate. And so it's not just important what the MRI shows; it's actually really important what you're able to do because of being on this medication. And so we're trying to find different ways to measure response that don't have anything to do with the MRI, but more to do with your quality of life and your functioning and how the plexiform neurofibroma is impacting that. So you brought up a really good point. What is it like as a patient to hear that there's a potential trial coming down the line? Because I know we've been on this road together.
It's amazing just knowing that other people are out there and, listening to Children's Tumor Foundation and other people's stories. Because when I was younger, we never thought that we would be where we are today. I was just having surgery after surgery. It was so disheartening having this surgery that was really hard on me. I would have these tubes, and then it just grew right back, and hearing you might not be able to have another surgery because your skin can't handle this surgery, but now there's a medication where I don't have to go under the knife, so to speak. I can feel like I can be more normal, if that makes sense, because before I wouldn't want to hang out with my friends because I didn't want to hinder their experience. They'd want to go hiking and I'd be like, I can't. I'm afraid my arm is going to dislocate. And now I can go to walks with my friends and not feel like I'm being boring, if that makes sense. It's just so amazing that science is changing and things are accelerating, and where we are today, I can't even put it to words. I'm just so excited that we're progressing so well.
And some of you may not know, but Brianna comes from New York to Boston for all of her clinic visits, and has done so since she was a young child. And so, I think one of the things that we think about is, how does all of this impact a patient's life and quality of life? And one of the potential downsides to participating in a clinical trial is that you have to come back and forth maybe a little bit more frequently than you would otherwise. But on the other hand, you have access to treatments even before they become approved by the FDA. So, from our perspective, we recognize the big commitment it is as a patient, but want to bring these treatments as soon as possible back to the bedside once they become available.
And if I may, that's why I was so fortunate enough to talk to the FDA, and I expressed that. I talked about more televisits, as everyone's kind of doing now because of COVID, but this was before COVID, and I expressed that we have to look at the whole picture. We have to understand that not every patient is the same, and not everyone comes from the same areas. So it's just amazing that scientists actually wanted to hear my story and how I explained that it's not just neurofibromatosis, it's a broad of disorders, and that especially with NF, you can't always see our tumors. If you look at me right now, you would never know that my entire left side is covered in tumors. So it's just the overall importance of really advocating for yourself and working with your physician, and continue that outreach as much as you can so we can continue to raise awareness. So more funds can be donated so we can get more access for other people for MEK inhibitors.
And Brianna, you've done such an amazing job, advocating for yourself, for NF. But what has your involvement with CTF, and what has CTF meant to you as a patient?
It's meant everything to me. Even in grad school now, I talk about the Children's Tumor Foundation, and that's what really helps me want to be an advocate for everybody, for especially in education, the lack of resources I had because going to school with a chronic illness is, of course, difficult when you have to miss so much school to go to these appointments, and then your school's saying, why are you missing so much school? So it's really important for me just to advocate for everybody, and especially with the Children's Tumor Foundation now, being the ambassador, I receive such kind messages saying, I hear your story, and knowing that you're going to school and you're doing all these things and you show goal setting skills, it's really inspired me to want to reach my goals. And I feel like a hero in a way, and it makes me feel so happy. And now my professors at NYU want to share my story with their high schools to show, hey, this girl has a chronic illness and she's doing A, B, C, and D. So let's work together as a whole, as a community, and we can succeed as well. It's just a matter of putting positivity out into the world.
Well, Brianna, you're my hero too, but
but
I have to say CTF has meant a lot to me personally as well. I think I first got involved in NF. I have to think about when that was. Maybe back around 2003 or so, and have become more and more involved. But CTF was really important for me in providing some funding as a young investigator, and for a clinical research award a couple different times to get research projects off, and really allowed us to get additional funding down the line. So it really provided funding at a crucial time period as I was transitioning from a resident to an attending and to an independent researcher in the field of NF, where I could start some new pilot projects and really get those going. And I know that you participated in one of those, and that was kind of cool, where we gave our patients and families video recorders to talk about how their own experiences with NF and how it affects them in their daily lives. And we gave video cameras so that kids could interview other people in their family, other important people in their lives, their teachers, their ministers, their friends, etc. And then we created a closed Facebook-like site so that kids could communicate with each other. And I know that for a lot of kids, that was the first time that they really had a chance to interact with other teenagers who had NF, and really had made a big difference. So, I have a lot to be thankful for as well from CTF in terms of funding. And I have a lot to thank for you, Brianna, because I feel like I learn a lot from all of my patients, and they teach me about NF. And certainly going into your home with a video camera made a huge impact on me to kind of see how things affect you, not only you, but the other folks who participated in the study, kind of see them in their own homes, kind of like we are today, and see how it affects people in their day-to-day lives.
And I, of course, appreciate you. You and the Children's Tumor Foundation are my family. I genuinely think that. And without the help of you and the Children's Tumor Foundation, and of course, my family, I wouldn't be the person I am today. I wouldn't be striving to want to help other individuals, and other individuals wouldn't be also messaging everybody. It's a community. And although, COVID is very hard to deal with, and I feel bad for what's going on, but I feel like it's brought us all together, and it's made us take a step and just realize to be thankful for what we have, and just continue to work as hard as we can to continue this outreach. And I'm glad to be a part of this family. I really am.
Yeah. And speaking of COVID, how do you think COVID has kind of impacted your overall journey with NF and your clinical trial experience and all of that?
So I was very nervous about the coronavirus when I first heard about it. I remember my mom told you I had a panic attack, my very first real panic attack in the hospital, because I was doing quarantine the day after my birthday, actually. Once the first case came, because my birthday is March 1st, and once it was official that it was near us, my mom was like, nope, lockdown. We're not going anywhere. She would get changed in the basement because she is a nurse. She would shower, not touch anything. She had a special robe downstairs. And every 3 months, I'm supposed to have a scan. So before then, once a month, I would meet virtually because the coronavirus, I'm unable to go to Boston just for safety reasons. But every 3 months, I do have to go in for the scans in Boston. And I stepped into the hospital, I saw all the arrows, and I was like, what is happening? And it just made me realize I'm not the only one that feels this way. And that's why I really like that the Children's Tumor Foundation had me doing other Zoom videos that went out on Facebook talking about this, because it's important for us to work together in this, because it's very hard to deal with, especially kids going back to school. I feel like they are going to have anxiety, and then being home is hard. So again, while this is all so hard to deal with, I think it's important to do Zoom meetings with your friends, do games, just try to stay connected as best as you can, because we all need that connection. We thrive on human connection. So it's just really important to work together, be positive, listen to doctors, and just do your best. I really believe it's been hard, but just try to stay home as much as you can is really all I've been doing. I don't go out. Again, it is hard, but I just surround myself with my family and do Zoom with my friends, and it's been working. And the continued research and awareness through Zoom has been great, because I get to outreach to more people.
And we still see each other fairly regularly by Zoom as well, from my home office to your home office, so to speak. So we see each other mostly every 4 weeks or so, but sometimes there's a visit in between. So that's allowed us, telemedicine has allowed us to really kind of continue and adapt to what's going on in the world around us, to making sure that you can still continue on your treatment as well. So I've asked you all the questions, so I think it's always good to give you a chance to ask me some questions as well.
How does it, okay, so obviously you've been a part of many trials since this is our second one. How is it for you seeing the impact that this is having on all of your patients? How does that make you feel?
It's pretty amazing. I think, when I started in the field of NF, we didn't really have any treatments, as I mentioned. And sometimes you can't see the changes on the MRI. And one day I saw a boy who had been in a wheelchair and not able to stand or walk down the hallway. They saved this as a surprise for me. He'd been on a MEK inhibitor therapy, and seeing that then 17-year-old boy come walking around the corner and come down the hallway was really just amazing. And he did somewhat reluctantly let me take his picture, and I shared it with some of the other doctors on the team, including some that have cared for you, Brianna. And their first reaction was, wow, what did you give him? Because the change was just so dramatic. And I think that's a good example of how function can really tell a lot more about the story of how the medications are working than just how the MRI is. And that was a time where I felt like, wow, we are really like finding something that makes a difference. And that was huge.
That's amazing. I completely agree. Before I wasn't able to lift up my arm. Now I can. I'll show everybody. So I am wearing a long sleeve shirt, but before I was not able to even roll up my sleeve of my arm. It was so big. So last time you guys saw me at the gala, it was hanging, but this is all skin, all right here. And I can lift up my arm. I couldn't do that before.
Yeah, so before when we started, Brianna could only get her arm sort of like to this, and now she's able to really pull it up. So it's huge. And as she said, we make her do all sorts of fun tests each time that she comes back, but that's a good way for us to measure your progress too. So it's not meant to torture you. It's meant to see how well you're doing. And we get all excited. We get as excited as anything. We get all excited when you can do it and do it faster.
I agree. My last question for you is we kind of already said, but besides from a science standpoint, just being an outsider looking at, so we'll take your doctor cap off for a second. What does the Children's Tumor Foundation mean to you as just a person, if that makes sense?
Yeah, so, I've had the opportunity to be involved with Children's Tumor Foundation in a number of ways. So, as we talked about, I was able to secure some funding as a researcher. I've also been a member of the Clinical Care Advisory Board, and within that work on educational brochures for families. I've also been worked on various different committees, and last year was one of the co-organizers of the International NF Conference. So I feel like I've been able to participate in a number of different ways and have benefited from that, both as a doctor, as a teacher as well, because I feel like my role is not only to treat patients who have NF, but also to teach them about their NF, so that, like you, they can go on to teach others and be good spokespersons for the NF community. And knowledge is power, and you always say that. And I think understanding what's going on and understanding what's going on the research side is also really important. So I try and be that conduit in terms of telling people what's going on in the NF field. And I feel like we're lucky to have even the web resources through Children's Tumor Foundation, where I can direct patients, families, educators, and things like that to find the resources so that they can educate themselves as well.
Definitely. So overall, I just want to say thank you. And thank you for the Children's Tumor Foundation for your mission and support and allowing me to be this year's ambassador. And I think to everybody, it's just really important that we continue advocating and funds are so important, not only to help myself, but the other individuals that are impacted by this disorder. And if we keep spreading awareness, that means the more individuals with NF can receive this treatment. And then that will also help their families, because of course, we have to think about the patient's families. It's impacting them as well. So we really have to work together to end neurofibromatosis.